Welcome to the City Current Show, powered by Higginbotham Insurance and Financial Services.
This show focuses on sharing good news and powering the good in our community. Now here's your host, City Current CEO, Jeremy Park.
Welcome to the City Current Show, powered by Higginbotham. I'm your host, Jeremy Park. We're always honored to bring you inspiring stories of individuals and organizations making a difference and powering the good. And we always love talking about quality of life, independence, and so much more. That's why we're honored to have with us Dr. Karon Uzzell-Baggett, certified occupational therapist and owner of Specialized Occupational Therapy Services, also known as SpOTs, LLC. How are you doing?
Jeremy, I'm great, and I really appreciate this opportunity to talk to people about occupational therapy. April's Occupational Therapy Month, and I think this is a great way to kick off a celebration of a wonderful allied health service.
Well, when you talk about occupational therapy, it is quality of life, it's independence, it's so much more, helping individuals, organizations, and so we'll dive in pretty deep. I want to start with how you got into this because you've got a unique background. First, thank you for your military service. Talk about your background and what led you into this industry.
Yes, thank you so much, Jeremy. I appreciate the opportunity. I do have a military background. I am proud to say I am a United States Air Force officer. I loved the United States Air Force. I followed my father into the service, so it was great being independent, and I certainly loved serving the nation. And got to travel all around the world, got to see some wonderful things. Some places were very nice that we got to go to. Some places not so nice, like Afghanistan, but it was wonderful to fulfill the mission. When I retired here in the Nashville area, I was looking for something to do that would allow me to give back. And so I decided to finally pursue a lifelong dream to have a career in healthcare. And Nashville is blessed to have wonderful opportunities with all the healthcare agencies and schools that are here. And so I pursued my education at Belmont University. I was one of the oldest students to graduate from the occupational therapy program, but it was great. I'm a big proponent of lifelong learning, and I like to model that. And occupational therapy has allowed me to take a lot of the skills that I learned in the military and now apply them to helping people live their best lives.
Absolutely. So talk about what occupational therapy is, and then we'll dive into all the good you do.
Okay, thank you. Well, occupational therapy is one of those kind of misunderstood misunderstood services. People really don't understand the whole breadth and scope that we do. People may be familiar with occupational therapy from the rehab context in terms of possibly being hospitalized after a car accident or possibly visiting a relative who is in a nursing home. They'll have physical therapy, occupational therapy, speech therapy, and so on. We traditionally work together as a team with other disciplines in some of our settings. Or they may be familiar with occupational therapy through working with their children in school if they're having some kind of delays in terms of learning or aspects like that. But that's really those are components of occupational therapy because its real goal is to help people live their best lives. It focuses on your daily activities. So we like to kind of get to know the patient on a one-on-one basis because we want to figure out what are their daily habits? What are their daily routines? Do they like to put on their socks first and then their pants? Little things like that matter when you may think about, you don't even put any thought into it when you're getting ready in the morning, what order you're doing something in. But if you were to have a debilitating condition, a severe case of flu, a car accident, or so on, and you're not able to do those things, it really matters what sequence you do it in and what adaptations you may need. So we come in and work alongside you to find out what matters to you and make sure that you're able to work and live your best life. Now, we do it not only in the context of taking care of yourself personally, but in the context of how you take care of your family. Are you a mother who needs to cook, who needs to care for a child, or so on, and you've had something that's kind of stopped you from doing it efficiently? We can come in and help you with that. Or certainly in your workspace too. Is there something that you're doing at work that you're very distracted or you're very stressed? Your console's not set up right. We can help with all those ranges.
I want to come back to the individual side, but I want to bounce forward to the corporate side, just like you're talking about, because when you look at organizational pieces, working in and doing education and workshops and training and consulting, that's a piece of this is working with organizations. Talk about your work with organizations.
Thank you so much. Yes, that is really, I think, where occupational therapy can really be a game changer. It can be a wonderful component that you offer your employees that maybe you hadn't thought about before. So I've had the pleasure to work with organizations on stress reduction, kind of incorporating mindfulness and just a kind of just a variety of techniques to try to reduce the level of stress. These are tumultuous times. And so you want your people, whether they're working in person in the office, and trying to figure out how to make that happen since they've been working remotely, how to change their routine so they can effectively report to the office, or if they're working in a virtual space still, how to maximize that so they don't have so many distractions. So certainly I've had a chance to talk about that. I've worked with them on trauma. There's, sometimes we have some traumas that come up and kind of result in behaviors that we're not aware of. So working with trauma management, and then just kind of working with general overall health education. We have a rising amount of diabetes, unfortunately, and obesity in this country. So kind of working with people on simple steps they can take to kind of manage these conditions that can really come into play and damage their health as they get older.
When you're sitting down with leaders at an organization, they might have an idea of, hey, these are the things we'd like for you to discuss with our team. But what are the questions you're asking? What are the things you're looking for when you're looking at, okay, here's the situation. Let me get an assessment so I can really be proactive. What are some of the things you like to ask? What are some of the things that you're looking at when you walk into an organization?
First, I like to ask is kind of what's going on. I want you to kind of tell me, and I'm talking about when I'm talking to leaders, I'm asking them what's going on. When I'm talking to the individual groups, be it an affinity group or be it an individual employee, what's going on? What's bothering you? So I really want to get to the nature of that. And then as I'm doing it, I'm kind of watching. I'm kind of watching the interplay with the group. I'm also watching, just kind of all those subtle things that happen. And then the other question is, well, can you tell me how you're doing something? Occupational therapists are very good about breaking down steps in details. We call it activity analysis. So kind of looking at how a task is performed, gathering that information. And then sometimes it's like, would you be interested in taking an assessment? Because sometimes assessments can provide hidden details too that help you form a plan. And then it's once you gather all that data through, certainly subjective and objective means, just kind of formulating a plan and then working with the client on setting goals. So whether it's the corporate head, working with, okay, this is what I've seen. What do you think about these goals? And we work collaboratively with it. Occupational therapy is huge on collaboration. It's not a one size fits all. So you really have to come in, assess the situation, and then jointly develop a plan. And then it's putting that plan into place, getting feedback, and then seeing if we can work toward a reasonable solution.
Talk about working with our more experienced adults, our seniors.
Yes, our seniors are really, a wonderful generation. And we all want to live our best lives. And I think, we work and we grow families and so on. So when we get to a certain age, we want to live our best lives. We want to, and the important thing is we want to stay in our homes as long as possible. And that's another thing where occupational therapy can be a wonderful aid. We can come in and help you assess your home, the way it's set up. Are there hazards? Having spent some time in the rehab space, I can tell you there's nothing more heartbreaking than seeing an individual who is there in a bed in pain because they've had some kind of fall or injury, and they may be able to do rehab and leave the hospital. But sometimes that injury will exacerbate other things that were underlying conditions like cognitive impairment that may speed the decline cognitively. So I want to help them not get to that space. I want to intervene before then. Our seniors deserve the best life. They deserve to age in the communities that they want to age in. They deserve to age in their homes as long as possible, as long as it makes sense. But sometimes they're not able to. And so, really, I really love working with someone and just kind of giving them a couple of more months or a couple more years to be surrounded by loved ones and live where they want to live. And also do those things they want to do. They still want to get out, volunteer, and be active.
You don't have to name any names, but talk about what success looks like. So paint the picture of going through the process, and it can be an individual, it can be an organization. So when you look at the journey and the assessments and, helping them to get back on solid footing, thrive, regain their independence, paint the picture of what that looks like.
Okay, for an individual, success looks like helping that person if they had a stroke. be able to go home and now be able to maneuver around their house using maybe an aid like a walker or something like that, but be able to go into their kitchen and make themselves a meal, a simple meal, such a thing such as a BLT sandwich, something like that, something that simple, or just know that they can, complete a task, their laundry or whatever, without having to have someone else come in or without burdening their spouse who may be caring for a small child or even their parent or so on. But it's being able to return to doing those activities you want to do on an individual basis. In terms of a corporation or a small business or something like that, it's having your employees come in more relaxed, being able to focus more, and just being able to just be happier at work.
How has this work changed you as a leader, as a person, when you look at, obviously the service, the transition, helping individuals, helping organizations? How has this helped you?
This has helped me because it has given me a chance to still keep serving. Being able to serve is really kind of part of my DNA. That's one of the reasons I joined the Air Force, and I loved it. I was there for well over 20 years. It was great to serve. I got to work in several capacities. One of my favorite, though, was working as a commander. So I got to help young people coming into the service, give them direction, both officer and enlisted. I got to command units where we helped them chart their whole career paths and got to help, certainly we sent them out to places that sometimes were really, really nice, nice assignments like Hawaii, and sometimes places not so nice, like Afghanistan, but we got to do that. And then also see them transition, giving them all that education that they needed to transition out, but also taking care of their families too in some capacities, through the family support centers and so on. So I loved being in charge of all those components. And when I retired from the military, and excuse me, going back to my military service, I had the honor of training my replacements right before I retired as my last job. I was a Reserve Officer Training Corps commander. So I got to train young men and women in college who then went on to be very successful Air Force officers. So that was wonderful. Then when I got out, I wanted to keep serving. So I looked around and I thought, I have landed here in Nashville, Tennessee. They have a plethora of opportunities to pursue kind of a career field that I didn't know too much about it, but I jumped in and I was like, this is what I've been looking for, occupational therapy. This is what I want to devote my time to. And so I started on that path and it's worked out very well.
How does the process start for an organization, an individual who wants to work with you? Talk about where it starts.
Okay, well, it starts with a phone call or an email. And then once we start with a call, we kind of assess kind of what is going on, what are you interested in. Certainly we meet in person, develop a plan of action, and then we put that plan of action into place and then kind of look at the results, reevaluate, and so on. So that's what it looks like. It's a fluid process because, as I said, there's no cookie cutter solution to what is affecting one individual or what is affecting one organization. You have to be flexible. You have to use evidence-based research, particularly when you're dealing with people. And you have to keep, and you certainly are. It's a collaboration. It is a collaboration. OTs definitely collaborate with their clients, and they collaborate with other disciplines when they're in settings like hospitals or skilled nursing facilities. The same thing happens when you're working with an organization. You're collaborating with the various departments, not only the head, but also the affinity groups, the bosses, and so on.
Talk about the duration, because obviously it's going to vary greatly. Where some, I would imagine, you might have to see weekly or even daily. Others, it might be monthly. Talk about kind of the timing of this in terms of how it plays out.
Typically, and I focus, I should say, on primarily community-based services. So I am not in the hospitals working in the rehab setting or so on. When you're working and having worked in the rehab settings, that's when we're working daily on a client because we're helping them try to progress to a goal in probably like a 6-week time frame, depending on insurance, because insurance and other things come into play. So that's where you see the daily treatment. What I do in terms of community-based services is primarily, it'll be maybe once a week, check in once or twice a week. It will be in terms of duration, and then going on for about 6 to 8 weeks normally, and then a period of time for people to implement whatever the solutions are that we came up with or the techniques we came up with, and then a check back in about 6 months.
We'll wrap up with contact information. So, phone number, website, where do we go to learn more and get in touch with you?
Okay, thank you so much. Well, my website is www.spots4u.org. And if you want to call me, my number is 615-609-4191. I also have a LinkedIn page, so I would love to chat with you. So give me a call. I've got spots for you.
That's like the perfect name. And so once again, the website spots4u.org, but it's SPOTS, the number 4, and then U, the
Yes.
letter U. So spots4u.org. So SPOTS, the number 4, the letter U.org. So I love the creativity around that. Karon, thank you for all you do to power the good. Thank you for coming on the show.
Thank you so much, Jeremy. It's been an honor to speak with you and your audience.
Higginbotham Insurance and Financial Services is proud to power the City Current Show. We're a people-first company that protects what matters most, the families, businesses, and trailblazers that keep our community going. As one of the nation's top independent insurance firms, Higginbotham is a single-source solution for business insurance, employee benefits, HR services, and personal insurance that's customized for you. We're here to serve you, the people you care about, and your community. Call 866-377-1959 or visit higginbotham.com.